to your health. Today I will be talking about gum disease. Did you know that more than half of all US adults currently have a form of gum disease right now? Yes, that's right. Gingivitis is one of the most common forms of disease found across the US. Over 60% of all Americans over the age of 30 have some form of gingivitis, whether that's in the beginning inflammatory stage or whether it has progressed to bone loss of the periodontium and is now considered periodontitis. And why is this so common across the US? There's lots of factors to it. To this reason, I'll be talking about gums, gum disease, and how to address these things before it causes bone loss and the scary potential of your teeth falling out. I know that sounds pretty unfortunate, but with a little bit of prevention, we can all ensure that we can address our potential gingivitis before it progresses to something serious, more serious, like periodontitis. So how can all these things be? Why is gum disease so common, especially in our communities? You see, even if you are brushing your teeth twice a day, if you're not going in for regular hygiene cleanings or flossing daily or bidaily, you will likely develop a form of gingivitis. Now, gingivitis is what happens when food and debris get trapped under your gum line. Bacteria love trapped food in tight spaces, and the tighter the spaces, the more toxic those bacteria will be. When bacteria feast on the trapped food along your teeth and along your gum line, they release what's called lactic acid through their metabolic processes. The mouth is most healthy and most able to repair itself at a relatively basic pH. Unfortunately, bacterial accumulation of the gum line will cause a more acidic pH due to the constant release of lactic acid. Acid, as we know, will destroy both soft and hard tissues over time. And once bacteria proliferate, there's no sign of stopping them. So, like I said before, the best cure is prevention. So how do we know that bacteria has taken over our gum lines, causing gingivitis in us? In dentistry, we reference Galen's 5 signs of inflammation, and these signs include redness, swelling, odor, heat, and loss of function. All of these signs and symptoms are a sign that there is active bacterial infection happening at your gum line. When it comes to oral disease, you'll additionally be seeing bleeding due to this infection. So if you brush your teeth or if you floss and you're seeing blood, chances are you have a form of gingivitis. Now, why is this inflammatory state occurring in us? Well, there's a big major player called cytokines. Cytokines are one of the biggest players of the immune system. Cytokines are part of the inflammatory pathway cascade that can alert both you and the rest of your body that infection is occurring. Just to repeat, when something is inflamed, like a cut, bruise, or in the case of gingivitis, your gums, it's a sign that active disease is present and progressing. The inflammatory state of your gums is because of release of cytokines like IL-1, IL-6, and tumor necrosis factor 8. That sounds a little scary, of course, but this is the sign of gingivitis, and again, the best cure is prevention. When you notice that your gums are puffy, swollen, or overgrown, that's a sign of bacterial accumulation under the gum line that results in inflammation. Now, I'm sure many of us have been to a hygienist for a cleaning. When the hygienist probes your teeth and checks your pocket depths, anything above 3 millimeters of depth is a sign of inflammation. Once you start hitting gingival pockets in the 4 to 5 region, you are unfortunately starting to experience what's called periodontitis, and this is severe inflammation that's causing bone loss. Now, periodontitis is the most advanced form of gum disease that oral health professionals recognize. We measure periodontitis through what's called clinical attachment loss and through other clinical findings like x-rays that show bone loss. Unfortunately, patients suffering from severe periodontitis will also experience symptoms like bad oral odors, pain upon chewing, loose teeth, and eventually the loss of teeth. Comorbidities, or the simultaneous presence of 2 or more medical conditions in a person at the same time, will often result in worse disease outcomes than a single disease alone. And we see this commonly with something like lupus and cardiovascular disease. Comorbidities can be especially difficult to manage when multiple systems are potentiated through the body's inflammatory response. And sometimes it's hard to know whether the comorbid condition is the chicken or the egg. Most common comorbidities for periodontitis include HIV, diabetes, hypertension, sleep apnea, COPD, osteoporosis, and strokes. Now, all of these comorbidities are, both a result of age, kind of getting older in a place like the US, and also some lifestyle changes. So, Periodontitis is fairly uncommon for patients under the age of 30, although it can occur in some younger people with poor oral health or genetic predispositions. Periodontitis is most commonly found in older non-white males. Unfortunately, in America, older Black individuals and Black males specifically are most likely to develop this disease. Now, dental professionals can manage periodontitis through non-surgical scaling and root planing therapies, debridement of calculus, and surgical periodontal therapies that what a periodontist would do. And periodontists are dentists who go to school for more training to manage issues and surgeries of the periodontium. Now, periodontal maintenance is required for every patient who has had periodontitis in the past. And both periodontists and dental hygienists are the experts on periodontal disease. General dentists like me are experts of restorative dentistry, people who do your fillings, your crowns, and everything else. Both forms of professionals must work hand in hand to make sure that our patients are receiving the best care for their gums and periodontium. Thank you for tuning in to Your Health. My name is Dr. Akua Owusu-Dommey, and I hope that we can all do our best to see our dentists and our hygienists for cleanings and make sure that our periodontium is healthy.